Welcome to the first International Breast Cancer Rehabilitation Summit. Today we have Avinoam Lerner online. He is an author, innovator and a practitioner in the field of complementary medicine, specializing in cancer recovery.
And I want to talk about the missing link, the mind, and do so in the context of its relationship with the body. The mind interacts with the brain, which interact with the immune system via the central nervous system. It is the foundation and the reasoning for integrating or thinking about integrating hypnotherapy into mainstream. And there are many significant factors that affect health and well-being. Here it's simply say that emotions play an important role in the development of physical disease, that different stressors produce different reactions within the body, and these reactions alter the state of homeostasis. And my favorite one is the last one, which really says that there is a bi-directional interaction between neuroendocrine system and the immune system. The brain, in this case, influences the immune system via the central nervous system, which in turn impact the body's resiliency and its ability to maintain its balance, maintain its health. Dr. Cunningham says that suffering is a mental reaction to events perceived as unwanted. And much of the suffering cancer causes come from reflecting on the diagnosis and what it implies rather than directly from the disease itself. And cancer is thus, as he says, is an existential crisis. Dr. Alistair continues and says that there are two main ways to relieve suffering. One is you remove the event, which of course in the cancer care we would love to do, and that's the very purpose of treatment, but very often it's just very hard to do. So if we can't necessarily rid ourselves of cancer because we are right now in treatment or we're in recovery, but fear is still there and everything else is still there, we can change our mental reaction to that particular event. We can really employ hypnotherapy to effect change. Hypnotherapy and the method that I'm going to present very shortly, we can resolve all of those. And you can imagine the impact on patient psyche, on their ability to become more resilient and more able to cope with and fight the illness.